Drop your right shoulder. Yeah.
Oh,
Let that relax for me. Oh, there you go. Here's the vertebral body or bone. Between each bone there is a disc. Hello Baltimore, it's Dr. Jeff Kalstein, your Baltimore area chiropractor, and I'm with Tilo this morning. Now Tilo, how long have you been coming to see us?
Oh, long time.
Your family comes,
My
correct?
family, my daughter, my wife,
Wife,
everybody, my friends, I recommend everybody. It's been a long time, in 10, 12, possibly 15 years.
Yeah, so we last saw him was in 21 and hadn't seen you for about 8 months, then you came back in early August because you were driving something somewhere.
It's sporadic, we're really busy, so I don't really have a lot of time to sometimes come here, which I really should be doing. However, I drove out to Montana, fifth wheel camper, nice vacation, and that's 20 hours behind the wheel, and then with a crick in the neck, you sleep a couple of hours, and you do the rest of the leg, and then you have your vacation, everything is fine, and then, 51 years of age, and I did the same trip back, and it beat me up, and I just had back pain, I had muscle pain, everything was tight, my neck hurts all the way down to the lower back, and sometimes it causes that sciatic nerve pain. And I figured I gotta get adjusted, and I come in here, I get adjusted, and it is just amazing. It just frees you up. It's like I'm walking on a cloud, I'm walking out of here, and they're not like, there's a lot of chiropractors who have a reputation, and the Kalkstein practice is not like that. They don't hurt you, they are gentle, they are moving slowly about it, and that's what I like about them. It's just, it's always a positive experience. You always walk away like healed. It's good, I like it.
Yeah, thank you. And I think what's important too is we take Tilo at his pace, not at our pace, So how long he decides to benefit from what we do is up to Tilo, and he knows we know when he comes in, he's really needs our help, right? So we adjusted him twice, and now he's back with a different problem. What brings you back in today? You tweaked something.
I tweaked my knee,
Yeah.
and I have no idea what I did. I really don't know. I'm very active. I'm up the ladder, I'm down the ladder, I'm in a crawl space, I'm under a piece of equipment. Like I said,
working out
exactly. So I have no idea what happened, but right now I have a lot of pain in my knee, and I'm confident that Dr. Chev's going to take care of it.
Yeah, so let's start this way, and I like to do this. Come on over here, Tilo, just stand right here. And Sammy, come on over here for me, because we'll catch this. Go ahead and turn your head to the left for me as far as you can go. Yep, and go back the other way. Yep. Now look straight at me, and now rotate it to the left as far as you can go this way. Beautiful, and then go back the other way. Good, good. Now, I want to see you bend to the right, laterally bend to the right for me. You okay there?
Yep.
Yeah, where do you feel that?
Back here.
Yeah, okay. Now go back the other way for me. All the way this way. Yeah.
Better, but I feel it back here.
Over there, yeah. So stand up nice and tall for me again. Go back to the left again. Good. Now go back to the right again for me this way. Good. That's good. That's pretty good. Okay. All right, so let's have you come around this way, Tilo. Why don't you slip your glasses off for me first? Lie on your side facing me this way. So, how many hours in the seat? 25 hours?
I was 20 to 22 hours in the seat one way.
What state?
From here all the way to Wyoming.
Wyoming.
Yeah, and actually Montana. This time it was Montana.
Yeah.
So, and the wife and the child, they fly.
They fly.
So I get to drive and set it all up on time and then pick them up from the airport.
So you get two vacations.
Yes, sir.
You get the vacation driving by yourself.
Which I don't mind, but at my age.
Then you get a family vacation.
Yes, sir.
Sometimes that peace and quiet is priceless. So I'm going to tap you on your hip for you. And let that relax for me. Oh, there you go. Also other side. Tilo, is that uncomfortable at all?
No, it's good.
It's and it looks like it might be, but it's just quickness that's happening right now.
It's the anticipation.
Yeah.
The human.
But you do a nice job. If I say to you relax, you relax. If I say relax to my wife when it's time to adjust her, she goes in the opposite direction. She tightens up a little bit. There you go. Let that drop for me. There you go. On your back for me now.
Yeah, I've been doing it for a while, so.
Yeah, so you know you're not going to come off the table, right?
Yep.
So I'm going to adjust this hip. This is your good knee, right?
Yes, sir.
Yeah.
Oh, I felt that. Good.
Beautiful. So I want to release the pressure in his hip.
Yep. Oh, I felt that too. It's good. Very good.
And again, put your hands on your belly and rotate this way for me. Yeah. Let your head just sit right into the pillow. That way. We should have a mic on that one. That was a good one.
Yeah, what makes the cracking?
You don't know what that makes that sound? Yeah. So your spine has hinges or joints. Drop your right shoulder. Beautiful. It has hinges that allow movement to occur. And I'll show you right here. The spine. So I'll use the low back just simply because it's easier to visualize. You come on over here, Sammy. So this is the front of the spine. Here's the vertebral body or bone. Between each bone there is a disc. And then in the back part there are hinges where the structure from above and below articulate. That is a joint right there, and that is where the movement takes place. So if I took cellophane and I wrapped it around those two structures, that would be the ligament that holds them in close proximity. In between that space is synovial fluid, right? So the joint surfaces actually glide on the fluid. Immersed within the fluid is nitrogen gas. When we adjust you, we create a vacuum in that space. That gas that's in there, that nitrogen gas, is forced out, and therefore, when you crack your knuckles, the same thing happens. That gas is released and is expelled from the joint, and that makes the cracking. And that's important because what's important about that is there's passive range of motion, there's active range of motion. So my muscle contracts, I bring an outside force. At the very end, we hit what's called the elastic barrier. This is really technical. It doesn't want to go any further until you put an impulse or a force into the joint to overcome that elastic barrier.
Okay.
And when you do that, you create the vacuum. And what's important about that is when you get beyond that area where it's stuck, where it doesn't move anymore, and you get into that zone where there's better movement, you influence the nervous system, you influence the health of the joint too. So it's very productive, right? Yeah. Back on your tummy. That's a good question, right?
I've listened.
So the short answer is that's just gas being released, right? It's not the bones cracking, because some people think that. It's just gas.
Yeah, I've listened to it a long time, but being in front of the camera, I figure I'll ask.
That's what it is. Yeah, that's an added benefit right there. So you get into what's called the periphysiological space, right? That's technical. Some people would say that when you get an adjustment, we're just putting things back in line. But I think really what we're doing is we're restoring function, and we're calming the nervous system, or resetting the nervous system, right? So take a deep breath in for me and let it go. Now, he's a big young man, so he takes a little bit more oomph than the average would, right?
Oh, that was good.
Lift your bad knee up for me a little bit and put it back down. Let's do one more thing before we adjust that knee. Go ahead and stand up for me. What I want you to do is just give me a little bend in the knee, a little flexion in the knee, okay? A little bend, both of them. Yep. Now stand up and push your legs back as far as they can to the back door right now. Okay. Now do it again. Bend forward slightly. Now go back all the way back. Okay. Now back up on the table for me, please. On your tummy. On your tummy. So this isn't a manipulation. This is more of a setting technique. Have I adjusted your knees before?
Yes, sir.
I'm going to do the opposite knee first.
Up to Warren, I don't remember.
Yeah. And let's get the other side.
And it doesn't hurt now, it hurts when I put weight on
And
it.
your weight there, yeah. So I'm just going to reset it. There we go. All right. And let the table bring it back up.
It just feels good, guys.
Go ahead and stand up for me. So let's start at the top. Let me see you turn your head to the left. Yeah, go to the other side. Yeah, now look straight ahead. Rotate to the left. There we go. Now rotate to the right. See, that's a lot better right there. I don't know if you can pick it on the camera. Bend side to side with your low back. Yeah, go back the other way. Yeah, it's a lot better. Now, last thing, just again, bend those knees a little bit. Because when I was watching him, I felt like his left knee was more restricted than his right knee. Now go all the way back. Yeah. See that? That's your right knee. That's good. Go ahead back again. Just push it back all the way. Force it back. Okay. How's that feel?
It's good.
Good. Yeah.
The
Yeah.
best thing they've ever done for me, I like I said, I do contracting work on commercial property. I work with skid loaders, buckets, snowplows, and I threw my back out really horrifically bad, and I couldn't move. It was winter. I laid on the cold concrete.
Yeah.
I tried everything. I crawled back in the skid loader. I turned the seat heat on. It was a 2.5 hour ordeal. Finally, I had to call somebody. I couldn't get out of the skid loader. I got out. I crawled in the back of the pickup truck. My wife drove me here.
Yeah.
Not one pain pill. 3 days later, I was back to normal.
Oh, yeah.
Because of
yeah,
that.
yeah, yeah, it's good. It's good. And you come back every once in a while.
Yeah,
Yes.
when I should be coming back more frequently.
You come back as often as you come in. Thank you.
Thank you,
We
sir.
appreciate you.
Appreciate
Yeah.
it.